right, we're gonna switch gears a little bit. My name is Kat McDonough. Can everyone hear me? Is this like good? Okay. My name is Kat McDonough. I'm a PGY2 for those I haven't met yet. And as part of the Social EM lecture series, I'm going to be talking about redlining and its implications on housing and health today, particularly as it affects vulnerable populations that we care for. I think that achieving health equity, in order to achieve health equity, you have to understand how discriminatory policies may have played an effect on the health disparities and social determinants of health that we see today. And I think redlining perfectly captures this problem. Some of you may know a lot about redlining. Some may have never heard about it before. I hope that I do this topic just some justice. It's a very big topic, and I hope that everyone, no matter where you fall on the spectrum of knowing about redlining, takes something away from this. Let me see. All right. So I wish I could move this. Can I use this? Okay, whatever. All right. Let's get into it. So in this topic, I'm going to be first going through a definition, some of the history of redlining, what its origins are, how gentrification is related to redlining, the different health hazards and health outcomes that we see associated with redlining, what we see today as modern day redlining, and then different things you can do in your day-to-day lives and in your clinical practice to be a more thoughtful citizen and practitioner in your clinical practice. I'm struggling. Okay. All right. So let's define it. What is redlining? So redlining refers to the discriminatory practice of refusing to offer financial services to residents of certain geographic areas based on the race and ethnicity of the residents in those areas. Redlining gets its origins back in the 1930s. So during the Great Depression, there was a wave of foreclosures across the country. Many people were not able to make their loan payments, and many people were facing or at risk of foreclosure. So in response to this, the federal government, as part of the New Deal, established the Homeowners Loan Corporation, or the HOLC. The point of the HOLC was to refinance mortgages and offer loans with better terms in order to help people avoid foreclosures. What the HLC did was create these color-coded security maps. And basically, they made an assessment of different neighborhoods and color-coded it and gave certain classifications based on how risky it may be to lend to residents in those areas or how desirable the neighborhood may be to live in. So each neighborhood was given a classification from Class A to Class D, Class A being the most desirable or the least risky to lend to, all the way to Class D, which was considered hazardous neighborhoods and were color-coded in red, hence the term redlining. We also see in between this neighborhoods color-coded in blue, which were considered Class B or still desirable, and Class C was considered a definitely declining neighborhood and labeled in yellow. So ultimately, what the government did with this was use these classifications to determine whether to guarantee loans, and lenders use them to determine if people were eligible for things like mortgages. So essentially, people in red zones, basically unable to get loans completely. People in yellow zones became extremely difficult to get a loan. So how did they make these classifications? So there's public documents that actually show that race and ethnicity was a predominating factor in determining what classification a neighborhood would get. While the government did also consider different housing conditions of different neighborhoods, throughout the public documentations of these assessments of the neighborhoods, race and ethnicity is an overlying theme in determining a classification. We're going to zoom in on this, but this is an example of the specific document of the assessment of Bed-Stuy, which is a neighborhood just near us, above us, where a lot of our patients live. And while it includes things about housing, if we really focus on some of the key aspects of this document, we see different themes as Black people infiltrating this neighborhood, the amount of Black people that live in this neighborhood. And then even in the bottom, we see here, each document had a clarifying remarks section. And in this clarifying remarks for Bed-Stuy, you see here they wrote, colored infiltration is definitely an adverse influence on neighborhood desirability. So throughout these documents, throughout different cities across the United States, we see that race and ethnicity is a very constant theme in determining the grade of the neighborhood. Bed-Stuy was given grade D. And if we go back to the map of Brooklyn, Bed-Stuy is up here. And it was redlined, and we know Bed-Stuy now is a large Black community for many decades now, and it really gets its origins in redlining. And I want everyone to remember this map. We're gonna revisit this and look at a number of maps, but this is really a key map that we wanna compare a lot of the maps that we're gonna look at too. All right. So the data shows that, not only is it documented that race and ethnicity was a really important factor in deciding a classification for a neighborhood, but the data supports it as well. So while Black and minority communities were already more likely to live in concentrated areas of poverty prior to the 1930s, we saw that redlining really exacerbated this effect. So this graph on the left shows that the further away that you got from a redline community in the highest risk areas, the less Black people you have living in those neighborhoods. As you get closer and more in the redline neighborhoods, you have a higher proportion of Black people living there. So the data really shows that Black people were more likely to live in areas that were redlined. So what does this mean? What effect does this have? This means that people who live in red and yellow zones are virtually unable to get loans, predominantly Black and minority communities. This makes it virtually impossible to buy a new home, to refinance your home. This creates stifled home ownership rates among minority and Black populations. This leads to homes falling into disrepair, property values decrease in these neighborhoods, and ultimately you see disinvestment in the community. Because property values decrease, these neighborhoods are considered undesirable. You have businesses leaving these neighborhoods. You don't have new businesses wanting to open their business in these neighborhoods. And you essentially get a significant disinvestment in the community, which we know also property values affect the taxes that go into our schools as well. So this ultimately creates an effect of worsened residential segregation and racialized poverty. This was really a state-sponsored segregation effort starting in the 1930s with significant effects that we see today. So let's focus more on this Brooklyn map. So the demographics of Brooklyn in the 1930s were quite different than today. Here you see Flatbush was actually considered blue, which is a grade B. Flatbush in the 1930s was predominantly Jewish. It also had populations of Italian and Irish Catholics. The Afro-Caribbean population really did not move to Flatbush until the 1950s and 60s. You'll see that most of Brooklyn, like over 50%, is labeled yellow or red. So most of Brooklyn was considered undesirable to live in, and therefore most of Brooklyn had difficulty getting loans. Only 2 neighborhoods are considered green in the 1930s. Here's Bed-Stuy, a predominantly Black community. Williamsburg was predominantly Jewish. We even see in a lot of redline communities, even if you're not predominantly Black community, just being adjacent to Black communities, the HOLC guidelines warned against being near neighborhoods that were predominantly Black because they said Black members will walk through your neighborhood. There's documentation from the HOLC that says that. So comparing it to today, obviously Brooklyn is a unique example in that Brooklyn is facing and has in recent years faced significant gentrification and changing populations, including due to immigration. So looking at Brooklyn today, this is a map of Brooklyn 2018. Looking at the Black percent of the total population. And what we see here is that while some redline neighborhoods are no longer or are not predominantly Black, a lot of our redline neighborhoods over here are still predominantly Black. Next, if we look at poverty rates, we see again here that our redline neighborhoods have higher rates of poverty than some of the other neighborhoods. Interestingly here, of course, these were redline neighborhoods, so now we're seeing less poverty rates, and we can attribute a lot of this to gentrification. So to just briefly touch on gentrification and how it's related. So redline neighborhoods were really a hot spot for gentrification. Gentrification, just to define it, I'm sure we've all heard of it, but gentrification is the influx of higher income, higher educated, usually white residents into minority and low income communities. Why are redlined areas a desirable spot for gentrification? So historically, redlined areas usually exhibit a rent gap, which is the difference between the potential value of a property and the current prices of housing. The prime location of an urban center paired with historical underinvestment and low rent prices really make a lot of redline communities attractive to young career professionals, developers, and investors looking to capitalize on the gains that they get from the gap in property values. An interesting statistic is that in San Francisco, 80% of neighborhoods undergoing gentrification were once designated as hazardous or redlined. We know that gentrification has a mixed effect on its residents. So while gentrification may increase access to things like grocery stores, parks, and coffee shops and things like that, it usually comes at a cost of higher living, and minority and low-income populations that have resided in these areas usually do not benefit in the same way that the newcomers in the neighborhood do. Also, because of the higher cost of living, gentrification puts significant pressure on displacement of individuals that have lived in these neighborhoods for a long time. And we know that displacement causes tremendous housing instability. So let's now look at some social determinants of health or health hazards as it relates to housing or the built environment related to neighborhoods. So we're going to talk about these different health hazards or social determinants of health. We're going to review them, their association with health outcomes, their association, some data that actually shows how they're associated with redline communities, and then look at some of the NYC maps and data. We're going to be looking at a lot of maps. I'm a visual person, and just always remember that map of Brooklyn and the areas that were redlined when we review these. So houses that are redlined are more likely to have difficulty upkeeping their homes. This leads to things like leakages, mold, exacerbated by things like poor ventilation, can lead to infectious diseases and respiratory diseases. We also know that lead paint leads to child development problems. And so these are the health outcomes associated with poor home maintenance. If we look at Brooklyn, these are interesting maps from city data. And on the left, what this is basically showing that in these lighter blue areas, the areas that were historically redlined, you have more homes reporting maintenance defects than in some of the other non-redlined areas. On the right, similarly, we know that cockroaches are actually associated with asthma. And so redlined areas typically have higher rates of reported cockroaches as well. Now let's look at food deserts. So a food desert is defined as a region that has limited access to healthy, affordable food options. Redline neighborhoods are historically more likely to be food deserts. This leads them to have more convenience stores, less grocery stores, and therefore less access to healthy, affordable foods. We know that this contributes to obesity, diabetes, and different cardiovascular diseases. And when we look at this study of Atlanta, for example, so this is a map of Atlanta and data from 2017, with the historically redlined areas outlined in red, we see that there's actually less grocery stores in these areas. The large yellow dots are where grocery stores are located. The small orange dots are where convenience stores are located. And you really see a concentration of convenience stores in redlined areas and a real lack of grocery stores in those areas. Looking at some data from New York now. So on the left, we have, where's my mouse? There it is. On the left, we have the percent of adults consuming fruit and vegetables, at least one serving in the past day. And we see that our redline areas in our own community at our hospitals are consuming less on average. And similarly, in the very same areas, this is looking at sugary drink consumption, the percentage of adults who have at least one per day. And we see higher levels in our redlined areas as well. Now, redlined areas are also associated with less green spaces. This refers to less parks, less tree coverage, and we know that more air pollution and heat also come from having less green spaces. These have been shown to have an effect on cardiovascular disease, mental health, and respiratory diseases. And when we look at this is a map of Richmond, Virginia. And the redlined areas are outlined in red, and green is a measure of tree coverage. And so we see in our redlined areas that we have significantly less tree coverage than in non-redlined areas. In New York, I thought this was an interesting comparison. So this map is showing percentage of New Yorkers who have access to a green space within 400 meters. And while we look at, our neighborhoods around our patient populations and redline neighborhoods, we do have a lot of access to parks. However, this map shows that the green area per inhabitant is actually significantly less in our redlined areas. So while we have access to parks, it is not equitable, and per inhabitant, we actually have less in our redline areas. We also know that redline areas, studies have shown that you have more air pollution in redline areas. So this has a lot to do with not only its location, but a number of other factors. But I think something really important here is that redline areas were more likely to be designated near highways. And then over the 20th century, highways were also more likely to be built in the middle of redlined areas. They're also more likely to be near industry, which create increased diesel fuel emissions. And we know that this has an association with respiratory diseases and cardiovascular disease. Looking at this study of redline neighborhoods in California, in the Bay Area, we have our redlined areas here. And this study actually showed that the redline areas have 2 times the amount of nitrogen dioxide pollution as the green areas over here. Looking in New York City at our air pollution, this is probably not surprising. A lot of our air pollution is concentrated around here, but we still see an increase in our redlined areas in our communities as well. Redline areas are also associated with hotter temperatures, hotter summer temperatures, hotter urban temperatures, more prone to extreme heat conditions. This has a lot to do with not only air pollution and kind of living on lower lands, but redline areas are also more likely to have paved surfaces that retain heat. And we know that this is associated with respiratory diseases and heat exhaustion or heat stroke. And this was an interesting study of 108 cities that looked at the average neighborhood air temperature as compared to the average of the city. And it found that in almost every city that it studied, redline neighborhoods were more likely to have hotter temperatures on average, up to 13 degrees hotter on average in redline neighborhoods in Portland, for example. This is just another visualization of Richmond showing that the redline areas will have higher recorded summer temperatures on average than the city, and especially compared to some of the green areas. And in New York, I couldn't find information on heat, but I thought this was an interesting data point. So this is a map looking at the percentage of households that have air conditioning, and our redlined areas over here, this lighter blue, shows that we have less air conditioning in our redlined areas, which contribute to heat-related illnesses. Also, flooding has been shown to be associated with redline areas. So redline areas are usually on lower ground and are more prone to flooding. This we know is associated with traumatic injuries, infectious diseases, respiratory diseases, and mental health from the trauma that flooding causes. And if we look at this study of Sacramento, these redlined areas, you can see a higher flood risk in redline areas compared to non-redlined areas. Flooding can actually be expanded to talk about a range of natural and human-made disasters, and communities vary in their ability to respond to things like flooding, different natural disasters, as well as different disease outbreaks. And so a measure that we can look at is the Social Vulnerability Index, or SVI. This is a widely used measure to assess a community's capacity to prepare for, respond to, and recover from different disasters and disease outbreaks. It's based on a number of different factors that pump out a number from 0 to 1. The closer it is to 1, the less likely that these communities are able to prepare for, respond to, and recover from disasters. And the government and public health officials use the SVI to determine where resources should be allocated when we have disasters or disease outbreaks. There's a lot of data on redline communities and different SVI ratings of neighborhoods. This is just one map. I chose New Orleans because I think when we think about a community's ability to respond to disaster, I think Hurricane Katrina is a perfect example, which completely devastated Black and low-income communities. And this map here shows that the red line areas tend to have higher SVIs, which mean less ability to respond to disasters and recover than non-redlined areas. If we look at New York, we see that our red line neighborhoods also have a higher SVI. So let's associate a lot of these health outcomes or these health hazards and social determinants of health with health outcomes. So there's a ton of data across different cities showing that redline neighborhoods have worse health outcomes than non-redlined areas. I think Richmond is a really interesting example with really significant disparities. So I'm focusing on Richmond here, and then we're going to transition and look at New York City data. But this study of Richmond compared this red line neighborhood, the Torrey Edmonds neighborhood, to a West End neighborhood that was green lined and looked at a number of different data points. What it found that life expectancy varied dramatically. So in the green district, the life expectancy is almost 90 years compared to those living in the red line district, 68 years life expectancy. Significant differences in poverty rate and percent minority, as well as significant differences in diabetes rates, obesity rates, pulmonary disease rates. Just to try to make it a little bit more relevant to the ED, this is a study that looked at rates of ED visits for asthma exacerbations and its association with redline neighborhoods. So this is looking at different cities across California, and all of the cities that they looked at across California, our redline neighborhoods have much higher rates of ED visits for asthma exacerbations. Now let's look at New York City. So we're going to analyze a bunch of maps, or just look at a bunch of maps and see how they do in relation to our red line neighborhoods. So this is a measure of child asthma ED visits per 10,000 children. And we see here in both our neighborhood and red line neighborhoods, much higher rates of ED visits for asthma in childhood. If we look at obesity maps, this one is looking at percent of public school children with obesity. And we see, again, concentrated in our redlined areas over here. We have higher rates of childhood obesity. Similarly, higher rates of adulthood obesity. My mouse is not really working. Okay. Higher rates of adulthood obesity as well in our redline neighborhoods. If we look at diabetes, all the same stuff. So higher diabetes rates, particularly this is looking at East Flatbush and close to our hospitals here, but still we see, in some of the redline neighborhoods, higher percentages of diabetes. And all these maps, you'll see that these areas are less likely to have a lot of these disparities. And again, that has a lot to do with gentrification and the changing demographics of those neighborhoods. Hypertension, again, heavily concentrated in our redline neighborhoods. And life expectancy also dramatically differs between neighborhoods. We see in our redline neighborhoods over here a much lower life expectancy than some of the non-redline neighborhoods. I wanted to compare Brownsville and Park Slope because Brownsville was a historically redline community. I didn't choose Flatbush because it wasn't redlined, so I wanted to look at Brownsville, which is both majority Black community now and was a redline neighborhood. And Park Slope we know to obviously be a more affluent white neighborhood. And so we see significant differences in obesity rates, diabetes rates, and hypertension. So people in Brownsville are suffering from significantly higher rates of these diseases. Also, the life expectancy is quite different. So Park Slope, life expectancy is 83 years. Brownsville, it's 76 years. So to kind of wrap up, I wanted to discuss kind of where we are today and how we got here and what have we done to mitigate or reverse the effects of redlining on our communities. So in the 1930s, we talked about the HLC was founded. In 1968, the Fair Housing Act was enacted. This was the point of this was to make redlining illegal, saying that you cannot discriminate based on race or ethnicity when offering lending services. In 1977, or also here in 1974, Congress passed the Equal Credit Opportunity Act, saying that your credit score cannot be, you cannot discriminate credit score based on race and ethnicity. And then 1977, the Community Reinvestment Act, or the CRA, was enacted to try to encourage non-discriminatory lending even further. This has been revised a number of times, but the CRA's purpose was to encourage banks to meet the needs of neighborhoods in which they operate, including low income and low to moderate income neighborhoods. What this meant is that examiners they conduct assessments of banks and issue performance ratings about how they're doing in terms of lending to low income communities. And this information, their grade that they're given on their performance of this, is used to determine if banks are able to merge or if they're able to open new locations. So in theory, if you're not loaning to low income communities in accordance with the CRA, you will not be allowed to merge or open new locations. A fun fact is that the Trump administration weakened the standards that the banks use to pass this exam. So the CRA is always constantly being adjusted, especially based on what leadership we have in office. Unfortunately, despite all of the legislation, we still see significant similarities in communities who have less access to loans or pay higher interest rates on loans. This data is showing that Black Americans are still more likely to be denied mortgage loans compared to all other populations, but particularly white and Asian. And because, when you're not able to get a loan, again, home ownership, this has had a significant effect on generations to come. So home ownership rates, we still have a significant racial gap difference between Black and white Americans in terms of who owns houses. And this gap has actually been increasing over time, especially from the 60s. We know that home ownership has significant implications on building generational wealth. So in the 20th century, particularly, home ownership was a significant factor in a family's ability to build generational wealth. And unfortunately, today we see significant differences still in the median family wealth based on race and ethnicity. So actually the gap is even widening, the racial wealth gap. White families now make 10 times more on average than Black families in terms of their median family wealth, which is increased from the 1960s. Same with Hispanic families. This is actually a political article from yesterday because a new update is that the Fed, after a 5-year effort, finally created new rules for the CRA. And this information just came out. It was literally sent this article from a friend yesterday who knew I was giving a presentation on redlining. But basically what I gathered from this is that they've expanded the requirements for lenders to lend to more portions of low-income communities. Unfortunately, it doesn't exactly address racial differences in lending and home ownership, but it works to expand the low-income areas that banks are required to lend to. So that was a lot of, I know, depressing information. And, institutionalized racism can sometimes feel like, oh, what can we do about it? But there are things that you can do in your day-to-day lives and in your practice. So just learning about these historical discriminatory practices, you're already educating yourself more. You're becoming more conscious of where you live, how it affects other people, how people who have lived in our neighborhoods for a long time have been affected by these policies. And it's really important, I think, to understand your communities and kind of what the breakdown and demographics of your communities look like and what their housing looks like, and also at a policy level. And that's why I just included that article about the recent update to the CRA, because I think it's really important that we stay up to date on what types of current day policies are affecting housing and health. I think it's also important that we make a point to consider housing in taking care of patients. So I would argue that especially our respiratory disease patients with COPD and asthma, make a point to ask about their housing. I know we get really busy and we're just kind of focusing on pertinent information, but if you have the time, it can be quite insightful about, especially people who are representing all the time in COPD exacerbations, asthma exacerbations, try to gather a little bit more information about what their housing looks like, especially if it matters in terms of whether it's an unsafe discharge or how our social workers can get involved. Consider their housing issues in discharge planning. Also, thanks to Kelsey, she pointed out to me that we do have a ICD-10 code for housing instability that you should use when having patients who are exhibiting housing instability. This helps us gather data on our patient populations and helps us argue that we need more resources dedicated to housing instability. Why is this not working? Oh, I'm stuck. Okay, and then some other just data that you all can look at that I pulled a lot of this data from is New York City. All of those blue maps are available on New York City public website. The New York City Community Health Profiles is an interactive NYC map where you can go in and select a neighborhood like I did with Brownsville and Park Slope and just compare a variety of different social determinants of health and outcomes between neighborhoods. Also, this website from the University of Richmond, Mapping Inequality, is where I got the documents about redlining. This is a really interesting interactive map that shows the security maps and has a lot of data and the real documents that that the HOLC used to discriminate against minority neighborhoods. And there's my sources.